This lecture will cover issues of cultural diversity. Communication is critical to obtaining a complete patient history, diagnostic images, and accurate diagnosis. Cultural diversities can create barriers to communication. In 1900, 1/8 of the Americans were non-white. Today, a quarter of the Americans are non-white, and in the future, half of the Americans will be non-white. Advantages of cultural diversity include you have a variety of perspectives, there are new ways of doing old things, and increased information and resources. Disadvantages of cultural diversity include health concerns due to conditions vary among cultures, languages can be a communication barrier, cultural beliefs may vary, inequalities across cultures, and attitudes and behaviors are different across cultural groups. The American Hospital Association, also known as the AHA, supports eliminating ethnic disparities in healthcare treatment and outcomes, and it also supports diversity in healthcare management. Culture is determined by the language and the customs commonly observed. Generalization of cultural attitudes and practices of groups can cause discrimination and misconceptions. Culturally significant attitudes that may affect communication include each society develops unwritten rules for expected and accepted attitudes and behaviors. Typically, we are comfortable with cultures that we work with on a daily basis, and some students perform clinical education at sites that are not near where they were raised and may have new cultures involved. Some cultures have a high level of sensitivity regarding modesty and physical contact. Women are better informed, more willing to talk about and seek out more health care than men. Many elderly patients do not ask questions about care and rely on the competence and knowledge of the caregiver. Baby boomers are more likely to question and not trust. And Generation Xers use a variety of resources for information and seek out alternative options. Religion can impact the type of care sought, the extent of care allowed, how much care is accepted diets or treatments, who makes the decision, and actions regarding life or death situations. Actively listen and wait for the patient to ask questions or to speak. Focus on relevant information while building a rapport, and watch for cues of understanding or a lack of understanding. For verbal skills, use a clear, distinct speech. Offer clarification or elaboration when necessary. Verify understanding by asking questions and repeating back information. Your attitude is revealed in nonverbal behaviors and verbal communication, so no judging. Be open-minded. And this is the point where you use what you learned in your humanities courses to treat others as you wish to be treated. In summary, it is not possible to know about all cultures in-depthly. You should be aware of the cultures in your area. Do not attempt to generalize or stereotype. Learn from your mistakes and watch for signals of misunderstanding or offense.